here at Urgent 9 Urgent Care Center located at 1000 North Central. We are here in support of Dr. Momjian, who also serves as the Vice President on the Armenian American Medical Society Board. Stay with us. We're going to get a great tour of the facility and of course speak with Dr. Momjian. For any further information about the facility, please call 818-662-7000.
Thank you for coming, everyone. I just want you guys to know that this is, I'm very happy, first of all, to see you all here, to see that you're supporting me. This is such a big day for me because I've been dreaming about this. I don't know how many years, probably the last 15 years I've been dreaming about this, and it's now kind of come true. With the help of a lot of people. I'd like to thank Glendale Memorial Hospital and all my friends from the Armenian American Medical Society were great. And I'm sure there's a lot of people, the city council members that are here, they've been supportive. And I just want to say that thank you so much for coming. And I hope that you all can appreciate what kind of a place this is going to become for the community. It's something that is very unique and very special. It's an urgent care that brings together an imaging center with it so that we can take care of more patients and see more problems without actually having to send them to the hospitals.
Dr. Momjian and I have known each other since April of 2005. We were actually doing a rotation in Armenia, and we met the first day when we both arrived in the Yerort Masiv section of Yerevan. And since then, we've kept in touch, and we've become very good, sincere friends.
I think this is such a tremendous undertaking by Mano. Dr. Momjian, I've known him for many, many years. We actually met in Armenia at one of our medical events, and I've been good friends with him ever since. And I just know the type of work that he does and the type of passion and spirit he has for his craft and for his patients, and I am certain that he's going to do very, very well here, and it's going to be good for him and as well as for the community. All the patients here will really benefit from Mano's contribution to the area.
I'm here with Nina, Dr. Momjian's beautiful wife, and before I get a few words from you, I do want to say how supportive and strong and amazing you've been, and it's so important to have a strong woman beside every strong man. So would you like to share a few words?
Sure. It's been a long journey for us, even though we've been open for 7 years. This is not a new office, but it's a much bigger and newer office at this point. So he's been working very hard to get where he is right now, and I'm glad that a lot of people came to support us, and hopefully this will be a new chapter, much better and bigger and brighter.
Here with Dr. Manuel Momjian. How are you?
I'm good, thank you.
Well, thank you for having us here. We're very excited to see your facility. It's absolutely beautiful. And we're going to talk a little bit about the services, but how can people reach out to you? And we're located here, of course, in Glendale.
How can they, basically, if they go online, they can just type in urgent9.com and they can find out about our address and phone number and so forth if they want to make appointments or if they just want to walk right in.
Perfect. So let's go check out the facility, shall we?
So let's start out with our vitals room. This is where patients will come when they first get seen in the office. This is where they'll take their blood pressure, their weight, their pulse, their oxygen saturation. We have everything is electronic, and so when you get your vitals taken, everything from the machine goes directly into our electronic medical record system. So there's no errors with entry, and so it also makes it very a little bit more comfortable for the patients, and it's a quick experience, so they can come get their vitals done and then move on to the exam rooms and or observation rooms.
So now we're in the examination room. Let's talk a little bit about that.
So basically, you know, patients can come here for various medical complaints. You know, we get a lot of patients that come in for sore throats or ear pain, a lot of chest pain and coughing symptoms. We diagnose a lot of pneumonia here. You know, you can come in for various complaints, abdominal pain, sometimes UTI symptoms, you know, minor cuts and sprains and so forth. And we'll talk about that a little bit more when we get to the x-ray and the procedure rooms.
Right, and then with your electronic medical records, you can then send all the files to their primary care physician, correct?
That's exactly right.
Awesome.
Yeah, so we keep a very tight record of what happens during the visit, and we send everything to the doctor, including, you know, whatever medications that the patient's been on, or whatever's been given here at the office, and what if they had any procedures done, any injections, or anything else like that.
Dr. Momjian, now we're in the observation room. So in what step of the way, or in what instance, do patients visit this room?
So this is for higher level acuity patients. So sicker patients can come here. Let's say you had abdominal pain and we need to draw blood and potentially get a CT scan or something like that, give IV fluids. Potentially you would be in this room. If you had, let's say, some chest pain where we didn't feel that you were actually, like that there was a low chance of a heart attack, and that we still wanted to make sure that you're not having any heart problems, we can put you in this room and monitor you and do all the blood work. We have the doctors that see the patients and evaluate, make diagnoses. We're able to do small procedures in the office. We'll do a laceration repair. We can do INDs, which are incision and drainage of abscesses. We can do toenail removals, mole removals, any kind of small procedure we can do here. And then there's blood work that we do here. A lot of urgent cares, you go to the urgent care and they don't even draw your blood. They just kind of say that's out of our scope, and they send you somewhere else.
Right, which is quite strenuous for patients in a condition like that to go to a lab and wait and everything. So yeah.
So that doesn't happen when you come here. You'll basically get your blood drawn here, and if we do it in a timely manner, we'll get the results on the same day. And in addition to that, we also have a full imaging center here with X-ray and CT capabilities, and I'll show you those rooms in a second. So this is a procedure room, and we can do all kinds of things, mainly minor procedures. These are obviously things that you're not going to need anesthesia for. We do whatever you can think of, we could potentially do in here, like removing foreign bodies from people's ears or from their noses. You can end up you know, getting a big abscess or an infection that needs to get drained. We can cut it and drain it. Potentially, you cut your hand with a kitchen knife, which is probably one of the more common things, unfortunately, for people. And we can sew up those kind of wounds without having to go to the ER and wasting a lot of time.
So now we're here in the CT room. Let's talk about the room, of course. And in what cases have you found that patients immediately would need a CT scan?
Well, CT scans are something that most hospitals have. Most emergency rooms are attached to have an attached CT scanner because that's usually how you diagnose acute problems. So, you know, if you have abdominal pain and you need to diagnose that, a CT scan is the first thing that you do. If you have a head injury, a CT scan is very important to make sure that you're not having brain bleeding or any kind of internal injury in the brain. Also, you know, if you're short of breath and you can't breathe, and we need to rule out blood clots or other types of problems that could happen with an infection, or even sometimes if there's fluid in the lungs or something else, we need to further evaluate that. A CT scan is usually recommended. So I think so far we've been seeing a lot of patients that get head injuries coming in and finding that it's very convenient for them to just get scanned and get an immediate answer on whether there's a problem or not. So this kind of, this before was not possible until we connected the imaging center and the urgent care together.
Right.
Before, it would be a patient would come in with a head injury, and basically we would send them straight to the hospital, and then from there they would have to wait and see an ER doctor. They would have to evaluate and decide whether they're going to get a CT, and that could take up to 6 hours, 7 hours. You wait for the CT scan to open up in the hospital as well. That can take like 3 or 4 hours there. So a lot of extra waiting, and so this is so convenient for patients.
Yeah, I want to commend you for bringing it all together and having a full service urgent care center. Very hard to find. I personally don't know of any. And so these records are also pushed over and sent to their primary care physician to review for further observation?
Absolutely. So what's nice is, the radiologists that we have that are supervising our CT scan are the same radiologists that are at Glendale Memorial Hospital. Right. So we have quality readings, and so we get a report and we can send that directly to the primary care. We can also make copies of the CT and give them a copy so that they could take it and have their specialist read the CTs as well.